I'm sorry to say the reaction of population is not up to the mark. They're not following the SOPs. And the people say that the health workers are the frontline workers. We say we are not the frontline workers. The population, the community is the frontline because they are exposed to it. We are the last line of defense. If frontline doesn't behave, all the load will come onto the last line of defense, which is the healthcare workers, because we will be overwhelmed with the patients and we will be in a situation where we will be more prone to get infection. And once these healthcare workers become infected, then we will not have enough workers to look after for the patients who come in. Because any sort of lockdowns or any sort of SOPs from the government will not work unless we are not willing to follow it. The first cycle, on an average, it used to be 35,000 a day. Now we have crossed about 48,000 a day, and the numbers are increasing. But I think, in my opinion, it is more than what we are reporting, because there are many patients, they have symptoms, they have someone positive in their family, and now the other family members are getting symptomatology. They are assuming that they are positive, so they are not testing themselves. The lower temperature favors the replication of the virus. So you can see the second wave in Europe also and USA also, and similarly it has affected Pakistan also. We are talking of vaccines. We don't know how effective it will be and up till how many months it will be. It's too early to say that how long the immunity will be there for the COVID virus. The best bet for Pakistan is the Chinese one, because the storage of Pfizer was -80. There will be a problem for transportation also. And actually, that will take some time to come to Pakistan, because they will be first looking for their own population, the Europe and the USA. But Chinese vaccines there are two advantages to it. One is they can be stored in normal refrigerator, 2 to 8 degrees. And the other thing is it is a single shot vaccine. There are few cases of reinfection, and that gives the indication that after you have COVID, you don't give up your SOPs. You have to follow the SOPs, and you have to wear the mask, keep the social distancing, and also cleaning your hands frequently. When patient is dead, the virus is dead. It all takes a few hours to be dead. So we changed the facility because it was creating a stigma. We were very strict in the beginning. We didn't know it. As the time passed on, we learned a lot. We revised the SOPs after the patient is washed away, and all the oral cavities and all orifices are closed, and then it is wrapped in a plastic bag. Then it doesn't become infective. So those were revised during the last few months of the first wave, and I was a part of that committee who developed these guidelines.